Hi everyone, welcome to Departmental Update number 4. We have quite a list of things to go through and then also some questions to review that have come into the Ask Fire Chief. So we'll dig right in and we'll start with PUIs for last week. This starts on Monday the 17th with 36 potential and 5 confirmed. Tuesday the 18th, 22 potential, 6 confirmed. Wednesday the 19th, 30 potential and 8 confirmed. Thursday the 20th, 28 potential and 6 confirmed. Friday the 21st, 32 potential, 3 confirmed. Saturday, 23 potential and 5 confirmed. And then Sunday the 23rd, 25 potential and 4 confirmed. So as you can see, our numbers of confirmed are going down. In the last week, the highest we had was 8 and our lowest was 3. All of you should have seen the promotional process email that came out. There has definitely been some concern about the date of the written test and when that will occur. I know many of you had vacations planned all through the summer, and with COVID, things have gotten pushed off. We are working very hard to establish a date for the written test. We know that other dates can probably be moved for some of the assessment portion. So we have a meeting this week. There are some other factors to keep in mind. This year, eligible in terms of years of service, there are approximately 499 individuals in the department that are eligible to take the lieutenant's process. Again, when I say eligible, this is just in years of service, but depending on how many people apply and how many people will take the written test, with all the COVID restrictions, it's going to be difficult to make sure that we have a facility that we can always safely administer the test to as many of you as possible. So there's lots of factors, but we're going to try and narrow down that date and at least get it in a smaller window so some of you can plan your vacations. Still working on a recruit class graduation. We're looking at the end of September. It's definitely going to be a modified and an experiment in how to do a graduation, something different, again with the COVID restrictions, and will most likely be on a Saturday morning in September. We've chosen an architect for Station 6, and we're working on that process now. We're also going to try something a little different with our design and build outs of new fire stations. We always have the captain of the station assigned to the new build of the station and to monitor that, but we also acknowledge that that individual is basically 2 days a week available because of shift work scheduling. So we're going to assign a day work captain to also monitor the project and hope that maybe we can stay on a tighter timeline. We can get all these little odds and ends in the process when it's happening, making sure that things are taken care of and not waiting till the last minute, and hopefully not taking as long as some of our other stations have taken to build. Safety officer requirements. This is something that was brought to my attention when I first came in, that safety officers were asking, do we have to be paramedics? Do we have to be RSI? Because of the way we were modeled with our field operations, it was a necessity to make sure that safety officers were paramedics and were RSI qualified so that they could kind of double as that EMS supervisor. We're going to take away that restriction now. So moving forward from here on out, you will no longer have to be RSI certified and you will no longer have to be a paramedic. Doesn't change where we're currently at, but as we move forward, those two requirements will be dropped for safety officer. T-shirts, right now we're in August and you're wearing T-shirts. I'm going to approve September for T-shirts being worn. Then in October, you'll have the breast cancer awareness T-shirts from the union. November 1st, we will go back to your regular uniform, which is your regular button-down or your polo shirts. So just a little timeline for awareness that September you'll be good for T-shirts, and October will be breast cancer T-shirts, and then November we'll be back to uniform shirts. We've been working with the State Highway Administration on a project between Rosehaven and North Beach in the 42 box. It's the Route 261 bridge is having a reconstruction project done that will last approximately 20 weeks. What we have worked out with them is overtime coverage for a medical unit, a BLS medical unit, to be in the 42 box in that area to assist with any medical needs, because that bridge will be out for 20 weeks. So you'll see overtime spots that'll be coming up. The project's going to begin approximately around September 15th. These will be Monday through Friday, and approximately 8 to 5, 7 to 4, something right in there for overtime spots for 2 individuals. And it's a BLS unit, but that doesn't mean that paramedics or anybody else can't take that those positions. So be on the lookout for that overtime, and that'll just be something new and kind of unique. And the State Highway Administration, we partnered with them, so they'll be taking care of the overtime coverage. Power DMS, if you haven't been in Power DMS, everyone needs to be in there on a regular basis looking at documents, making sure you're reading and signing. If you've noticed, you're no longer getting the orders by email, they're only in Power DMS. So that's going to be the way for you to stay up on information and make sure you're staying current. There's a couple of forms that we've been working on, along with numerous rules and regs, OPMs, lots of updates going in Power DMS. But one of them is a record of exceptional performance form. I mentioned it on one of the previous updates. We're still working on it. Antoine Chambers, that whole group in IT has really been doing a ton of good work and making sure that we have everything ready for the promotional process, along with making sure we have some of these forms that are fillable, easy to access, and really just easy for the members in the field to be able to use. So I know I mentioned that we're not quite there with it. It's still coming, but great work to that team and all the work they've been doing. A couple other commendable things for those of you that are aware of the Bay Bridge call that lasted 21 hours the other day. Just kudos to everyone involved in that. Really just tremendous work from everyone. The Combat Challenge also happened down at the Training Academy, so great work to the staff of the Training Academy who set that all up and made it possible for people to just try out part of the challenge or compete. It was a pretty hot day, but everybody did a tremendous job. We'd had a previous question about UV lighting in county buildings and in our transport vehicles. We looked into it. All county-owned transport vehicles, ALS and BLS, have a UV air filtration system built into them. We did confirm that with the manufacturer, so we are getting that, so I was happy to be able to answer that. We are working on it in the station systems. It's going to take a little bit longer time frame to be able to figure out if it's something we can afford, if we can afford to use CARES funding, and then what it would take to actually get it installed in some of the station air filtration systems. Another friendly reminder, please keep wearing your masks. I know everybody's doing a really good job with it. It's not easy, but please keep doing it. It's the right thing to do. We did have that stint where we had numerous positive cases with our members. Those numbers are going down, so it's working. So thank you for doing it, but please keep doing it. Don't get complacent. Do not get complacent on calls. Again, I know the PUIs are down for confirmed, but you never know, and it's just better for everyone if we're keeping in mind your health and safety. So please keep wearing your masks. Another social media reminder, it kind of goes along with the masks. If you're posting anything about work, number one, make sure that you are allowed to post it. Make sure that everybody is socially distanced and or wearing masks. And then probably the biggest thing, as we see just getting into a really heavy heated political climate as November becomes closer, anytime you have anything on any social media account that associates you with this fire department or an Anne Arundel County employee, you are held to our social media policy. If you are posting anything that reflects poorly and you are associated with this department on that social media account, we will be holding you accountable to the social media policy. Just make it easy on everyone. Post less, make sure you're posting the right things, and just please keep in mind that you represent this department at all times, 24/7. A couple of questions that came in. So let's see where we're going to start here. In regards to your plea for new paramedic students, can you shed some light on what the department is doing to help potential students? In particular, out-of-county learning. Is the department reimbursing students the full cost of the program once they have successfully completed the program? So I want to begin with just saying thank you first and foremost. Our numbers for paramedic school have gone up. So thank you for all the information you sent me on possible options, what to do. Again, normally we do 10 for in-county at Anne Arundel Community College and then 4 for out-of-county. We had 12 people that said they would be willing to do the in-county, so we're going to go 2 over the budget and take 12 with in-county. And then we have 1 for out-of-county. The out-of-county is a little bit more difficult with the funding. We don't fund any of the tuition. We do leave hours that match the leave hours that you would get if you were in the in-county program. There's a couple of things of contract obligations. We also have had issues with the caliber of the programs that some people have selected to go to. And then again, just the cost in general. We have to budget for out-of-county costs, which are significantly higher. And some of those things have an issue with the contract that we've already entered for the community college. So it's not as easy as just saying, well, anywhere 4 people want to go and we can afford the funding and do that. So I'm really happy. Thank you for the 12 of you that stepped up to go in county and the one that's going to go out of county. There is still time if anybody else wants to go, and you can get signed up for this year or next year, but really thank you for those that step forward. One question we have about point of entry locations at the fire stations. Why do we now have stations with the sign-in sheet and check temperature locations in the middle of some of the station? Kind of defeats the program. Did we change our entry program? I don't know of any changes, and I understand that what you're saying is basically once you're in the building, then you have free movement. The way those are set up is at the discretion of the station officer and particularly the captains. So if there is a station that doesn't have the thermometer and the sign-in sheets next to the door that you're entering, then I would ask that you move those closer. If it's been moved for some other reason, then there's hopefully a legitimate reason for that to be changed. But the door that's open and where those check-in and sign-in items are should be in close proximity. I'm wondering if there is a possibility of exposure or contamination via our SCBA regulators. This is a little bit of a lengthy question, so I'm just going to kind of move through it. At a glance, between the positive pressure system and the inhalation check valve and the face piece, this appears to be low risk. However, I thought it might warrant a better glance by someone who understands all parts of the SCBA. It's something we can check into. Again, there was a portion of the question that talked about sharing face masks, which we don't do, sharing gloves, which we don't do, but that there was a scenario of a fire out of county where 2 members later tested positive. So we'll take a look at that and see if there's any possibility. There's nothing that I have heard of at this point, and I'll get back to you on that one if there is something to report that there would be a contamination. This is a revisit from an earlier question about thermometers, infrared thermometers to check patients, and that basically using our thermometers, a patient read 96.6. When this individual brought the patient to the hospital, the patient read 103.5. We are relying on these to do temperature checks every day throughout the shift, and they are not working properly. I am very understanding that this is what the department went with after I'm sure many discussions and investigation, but I'm asking that we reconsider getting a more reliable and accurate thermometer that works, i.e. a hospital style. There is uneasiness in relying on something that we have experienced as not working. I appreciate your time and consideration. We'll check into it. When I checked last time with Doc Wendell about the thermometer, he said we are using the same grade that some of the hospitals use. At the time when the question was originally asked, there was zero availability of new thermometers or any type of other infrared thermometers. They were indefinitely on back order. So I will check on availability, and then I will ask Dr. Wendell to see again what BWMC and Anne Arundel are using, and if those are available, and if we could possibly use CARES funding to get them. So that's it for our updates. Quite a bit to cover. I just want to thank everybody for continuing to work hard. Please try and enjoy a little bit of this summer. Please make sure that you and your families are staying safe and healthy and happy, and we'll see you on the next update.